Hello and welcome to this presentation on the development of an online implementation outcome instrument repository. I'm Louise Hull. I'm a Senior Research Associate working within the Centre for Implementation Science at King's College London. Implementation outcomes have been defined as the effects of deliberate and purposive actions to implement new treatments, practices and services. Measuring implementation outcomes is extremely important to understand implementation success and failure, and as such, all implementation research should measure implementation outcomes in some form. Implementation outcomes can be measured using a variety of methods, including qualitative and quantitative methods. Over the past few years, there's been numerous systematic reviews published in the literature identifying and appraising the psychometric strength and more recently the pragmatic qualities of quantitative implementation outcome instruments. We conducted a systematic review of the literature to identify and appraise the methodological and psychometric quality of implementation outcome instruments developed and validated for use in physical healthcare settings. Based on the results of this systematic review published in Implementation Science, we sought to develop a free online user-friendly repository of implementation outcome instruments. We worked closely with Icon, a creative design company, to design and develop the repository. During the design phase, we sought feedback and recommendations for improvement from implementation stakeholders, including implementation science experts, applied health researchers, healthcare practitioners and patients in the public. We sought their feedback on the content, the design and usability of the repository. The repository currently includes 55 implementation outcome instruments developed and validated for use in physical healthcare settings, measuring 6 of the 8 core implementation outcomes included in Proctor's implementation outcome taxonomy, including acceptability, adoption, appropriateness, feasibility, penetration and sustainability. The repository doesn't contain instruments measuring fidelity, as such instruments tend to focus on specific interventions, therefore significantly limiting their generalizability. The repository also doesn't contain any instruments measuring costs, as no instruments were identified in the systematic review that the repository is based upon. The repository has been designed to allow users to search for instruments according to implementation outcome, view a detailed summary of the instrument, examine the methodological quality assessment of the psychometric study, examine the psychometric quality and usability of each instrument, and access resources related to the implementation outcome instrument. In conclusion, we have developed an accessible, user-friendly online repository for implementation stakeholders wishing to quantitatively measure implementation outcomes. We hope the repository will help implementation stakeholders identify and select a methodologically and psychometrically sound as well as usable instrument to apply in implementation projects.